both my primary school and high school. I later moved to Windhoek, where I completed my honors degree in environmental biology as well as geology. And then I recently completed my master's in medical entomology, and these are two different courses. This one pertains a lot of molecular work, while the previous honors degree contains a lot of environmental work. So I'm a proud product of the partnership between the University of Namibia as well as the University of California, San Francisco, the Malaria Elimination Initiative, as well as the Ministry of Health and Social Services of Namibia. During my studies, I was based at the Ministry of Health's National Vector-Borne Disease Control Program in Oshakati, where I helped the program with collecting data in malaria, and this entailed traveling to the 9 malaria endemic regions of the country, where we collected mosquito species and a lot of mosquito species, and this had to do with getting the species composition of mosquitoes in Namibia, which exact species that transmit malaria. During my studies, I was based at the Ministry of Health's National Vector-Borne Disease Control Program in Oshakati, where I helped the program with collecting data in malaria, and this entailed traveling to the 9 malaria endemic regions of the country, where we collected mosquito species. And I'm the first locally trained entomologist since Dr. Kamwi in 2005. My studies, the findings of my studies actually contributed to a change in vector control policy for the Ministry of Health, where I identified insecticide resistance to pyrethroid insecticides in the country, and this led to them changing the current products on the market, such as DDT and delta methane, to SumiShield and others. And the importance of my study is that we have different species in the country, and all these different species react differently to the vector control interventions. Vector control interventions are the ways that I use, or the strategies that are employed by the ministry to prevent transmission from one person, to prevent transmission from an infected mosquito to an uninfected human being. I guess I chose my suicide on the stage of poison day. Yeah, so it's very exciting to be in the lab. This is where I've always wanted to be. Like, I've always imagined myself being in the lab, running tests, identifying new stuff. I used to watch a lot of science fiction growing up, and initially when I started university, I wanted to do biomedical studies. Unfortunately, I did not get in. Then I came to do environmental biology. It's not what I wanted, but it served as a foundation, like as a basis for me to really grow and just learn the basics. Something I forgot to mention was that I want to create an opportunity to mentor young people who especially want to embark on these journeys of changing the world, studying things that bring about change and just not something that will settle on the shelf and collect dust. And like I mentioned, I'm from an environmental background. This is completely new to me, and I should also thank my team, the Biomedical Research Lab, that they have contributed to the researcher that I am today. I'm very much capable and I'm very much independent in the lab setting, as well as in the field setting, where my colleagues at the Ministry of Health have assisted me very much in terms of skill, capacitating me well in the field setting. Okay. And so I'm currently also mentoring 2 students who are at the public health campus of the University of Namibia. And so in order to embark on this journey, I believe that at least you need to have a passion. That's the first thing. I quote the late Chadwick Boseman, that's if I'm pronouncing it correctly. He said that sometimes life has to sting you in order to activate the true passion in you. And further on, he also quoted Jeremiah 29 verse 11. I don't know if I should narrate it or, which says that I have plans for you, declares the Lord, plans to prosper you and not to harm you, plans for a future and for hope. Because what we do in the lab is to assist the community at large. We collect the mosquitoes from them and we run them in here to give them feedback, not feedback per se, but to guide ministries, because this was operational research, and that is research that is not done just to be a reference point for other academics or future reference, but to serve the community at large, to make big time decisions, understand? So It's for everyone and it's for all. Everyone can do it.